Today we have a gentleman who is 35 years old who has been complaining of having some breast tissue in the area of his chest where even though he's very fit and he works out frequently, he's unable to get rid of this area. And what we're going to do, if you palpate this and feel it, you can feel the gland and the extent of the gland, but going all the way to the markings that I've shown. What we're going to do is just lipo a little bit to release it, and then go underneath and cut the gland out in this conformation, and then bring the tissue together and close the area to make it look like a more masculine and youthful chest. So we're in the OR with a gentleman who's 35 years old, really athletic. He exercises all the time, and he just can't get rid of this extra tissue that is over his chest. And this is really a gland, a breast gland, and he started having this when he was a teenager, and he has sort of bared with it for a long time, and finally decided that he's going to do something about it. So we're going to do gynecomastia excision. Often when we do this surgery, we do a bunch of liposuction because most men end up having some lipodystrophy, which requires removal using liposuction technique. In this gentleman, there's minimal amount of liposuction that needs to be done just to contour and create a more masculine and chiseled chest. This morning we did an operation on a gentleman who's 35 years old who came to me, and he was concerned about his chest. He worked out all the time and he wasn't able to get rid of what we refer to as man boobs. Take a look over there and you can see how athletic this gentleman was and how much extra tissue he had in his chest area. And what we did is we excised the gland, and we then did some lipo to contour and make his chest perfect. So in this gentleman, we removed the tissue that was essentially delineated with this marking, and you can see it's an extensive amount of tissue. But just removing the tissue is not the issue. The issue is making sure that we correct, after the removal, the area of loss of tissue by mobilizing the tissue around it and bringing it down and suturing everything closed so the nipple doesn't stick down and create a hollow area. And you can see how much tissue was removed, and yet once this tissue was removed, we're able to still fill this area nicely without making it look like a breast. And that's the most essential, important part of the surgery. We're now 6 weeks out from vasor liposuction and excision of gland on this gentleman, and the swelling has gone dramatically down. There's still some swelling that he has to go through, but everything looks much better. There is no indent, there is no excessive tissue, and everything looks perfect.